Motherhood is more dangerous in Afghanistan than almost anywhere else in the world. Women's low status is one reason 1 out of 8 women here die during pregnancy or childbirth. Most women give birth at home due to both necessity and tradition. A lack of decent roads and affordable transportation make it hard for them to get emergency services when complications occur. But many women are also denied life-saving care because male relatives are reluctant to seek help. Qurban Bibi knew she had to go to a hospital to give birth, since her previous delivery was by cesarean section. But to save money, her relatives took her to a local market instead. I pleaded with the men, I've got to go to the hospital, but they said, don't worry, God is kind. Everything will be okay. It wasn't okay. Qurban Bibi lost her baby and nearly bled to death. She also developed an obstetric fistula, a hole between her birth canal and bladder, leaving her incontinent. Now, religious leaders are being enlisted to counter the deadly neglect of Afghan women's health. Mullahs are trained to use their Friday sermons and community meetings to teach men and adolescent boys to protect the health and rights of women in their families. Among Afghanistan's deeply devout populace, religious leaders have enormous influence. Maulavi Sadiq Muslim, a senior Supreme Court official, helped develop the program. It relies on Islamic teachings.
The Afghan people believe in resolving issues from a religious perspective. Having a healthy mother and a healthy family is what it means to have a healthy marriage in Islam.
Maulavi Amanuddin of the Ministry of Religious Affairs says it is un-Islamic to deny women health care, whether for reasons of poverty or propriety.
Access to health services is an equal right.
18-year-old Nasira nearly died trying to give birth at home. She was in labor for several days and developed a severe infection. Her baby was stillborn. But the men who run her household waited 2 weeks before seeking help. Doctors at the Badakhshan Provincial Hospital had to remove Nasira's uterus to save her life. Nasira, who was married at 12, will never bear children of her own. I had a lot of problems when I came here. They took good care of me. The religious leaders' initiative aims to overcome the effects of decades of conflict and impoverishment. Maulavi Abduwali leads the training of influential clerics in Badakhshan, which has the highest maternal mortality in Afghanistan.
Because of the war and ongoing tribal disputes, most people live in ignorance. But when issues are raised in light of religious values, it has an impact.
The Religious Leaders Program was started in 2007 by the Afghan Ministry of Women's Affairs, the Asia Foundation, and UNFPA, the United Nations Population Fund. TV and radio spots, posters, and pamphlets reinforce the main messages. The initiative's theme is Healthy Family, Prosperous Society. In Friday prayers and community meetings, the trained religious leaders preach about the harm done by domestic violence, child marriage, and having too short an interval between births. Violence against women is rampant in Afghanistan. Most women beaten by their husbands or in-laws have no recourse. Those who flee abusive relationships can be jailed. Marzia's mother-in-law once beat her while she was cooking, causing hot soup to burn her arm. In an effort to reduce violence in the home, the mullahs talk to men about healthy relationships and suggest practical ways of managing anger and resolving family conflicts. Early marriage, still a common practice in Afghanistan, is another target of the Public Education Initiative.
During the war, many poor families had no choice but to marry their daughters at a young age. But now, most people believe girls should not marry before 18.
Religious teachings are also employed to promote birth spacing and challenge the mistaken belief that Islam does not allow it. The average Afghan woman bears 7 children, and only 1 couple in 20 use contraception. Increasing the average time between births could significantly reduce maternal deaths and injuries.
The Quran clearly states there should be 30 months between births to protect the health of children and mothers. When religious leaders and communities understand that this is what the Prophet Muhammad says, misconceptions within families can be resolved.
Organizers hope that religious leaders can persuade men to oppose gender-based violence in early marriage, practice birth spacing, and ensure women's access to health care. Success would mean a higher quality of life for all Afghans.